Hi guys, it's Dr. Sal from DrSecrets.com. Thank you so much for joining in. Today we're going to take a look at fibromyalgia. The F in fibromyalgia probably stands for frustrating or frustration. Fibromyalgia is probably the most frustrating thing for a family doctor today to try to treat. Primarily because we do not have a clear handle on what is causing this affliction that is affecting so many people around the world. If you ask me what's causing your strep throat, I can immediately tell you the precise cause of your ailment. Similarly, if you ask me what's causing your multiple sclerosis, your stroke, your ingrown toenail, I can tell you exactly the process that's occurring that's leading to this dysfunction. Fibromyalgia, on the other hand, all bets are off. We do not know. Most other conditions have a very precise diagnosis. Fibromyalgia, on the other hand, is more of a statistical diagnosis. Basically, we found this cluster of people that were all sharing the same symptoms, and we took a label called fibromyalgia, stuck it on that bag, and that is fibromyalgia. The underlying cause, the reason for the dysfunction, at this date, we still do not know. Probably the most wishy-washy explanation I can provide for it at this time is that fibromyalgia seems to be a neurological disorder, a subtle one, which leads to normally with skeletal muscle, it's supposed to relax when it's not being used, but even when it's relaxed, it still has some degree of tension in it. In fibromyalgia, the muscles, the baseline tension of the muscles seems to be a lot more. The muscles don't seem to want to relax, and that leads them to be sore, plus a bunch of other features that I'll go through in a second. The other reason why fibromyalgia is a capital F for frustrating is for patients, because the majority of treatments that we have to offer to date help to some degree but are not spectacular. If we look down here at the anatomy board, I'm going to go through fibromyalgia, the symptoms, how we diagnose it, and a little bit about the treatments that we have to offer to date. Another one of my pet peeves or frustrations about fibromyalgia is if you Google fibromyalgia symptoms or look it up in a magazine or book, what you'll see is basically information like on this slide here. Basically, all ailments known to man seem to be attributed to fibromyalgia. Clinically, that is nonsense. What I'm going to do now is erase the parts of this slide here that are not actually pertinent. Now, if you look at this slide again, no. What I've done here is I've dissected away all the fat, trimmed off all the noise. What remains here is the true diagnostic criteria for saying that somebody has fibromyalgia. Now, obviously, the cardinal one is going to be pain, skeletal muscle pain, and I'll explain more about that in a second. Some people will also describe some stiffness in their joints. Another key component, cardinal component to saying that somebody has fibromyalgia is, as you can see there, this is a female, and I would say probably 90% of cases seem to be female, so we don't know if it has something to do with estrogen and hormones. We're just not sure. But if you're female, you're at much higher risk of this condition. However, I have seen it in males as well. The other component of it is it's usually not just females, but females around 40 and later, say between 40 and 60. So this young lady here, let's say she's probably in her 30s. Now, even though the majority of cases probably arise after age 40, I have seen some cases as young as teens. Again, though, fibromyalgia is a statistical diagnosis, so you're going to see outliers on that bell curve, and then there's the majority, that's 66% in the fat center. The other diagnostic criteria with fibromyalgia is a history of lots of headaches, chronic headaches, and poor sleep. With the sleep disorder, what we're talking about is somebody who is sleeping, and even if they sleep for 8 or 9 hours a night, they still wake up unrefreshed. They still feel like they haven't slept. And as a consequence of this malaise or fatigue looming or lingering over people, they also tend to have subtle complaint of cognitive impairments, difficulty with short-term memory. Another thing that I tend to also find bundled together with people suffering with fibromyalgia is mood disorders, anxiety and depression. The depression may be a consequence of living in pain constantly, And the anxiety seems to go with the theory that the nervous system is hyperactive, causing the muscles to be constantly clenched. If we go back to the muscular component of the pain, there's more to it than just simply muscle pain. It's in very specific positions on the body. So that's going to segue us to this other slide here. So these are called trigger points or tender points. And using my little model here, so we have a little model here. Now these tender points, to elicit them, you basically use your thumb and you press over the muscle bodies of these areas here with the red dots over the body. So I usually start behind the patient and then I start palpating over their neck, here, here, and then symmetrically again over the upper shoulders, over the trapezii. And you don't have to press very hard. It's basically just hard enough that when you press, the blood in your thumb slightly blanches. If you poke anybody hard enough, you'll elicit pain. The key is just pressing just hard enough to elicit somebody who's suffering with tender points as opposed to just normal soreness. And the other thing to watch out for is people who are doing a lot of exercise. Sometimes they may have soreness, but it's not the soreness of fibromyalgia. It's just that they're recovering from a rough exercise. So those would be two more points. Then down here, then there's also points over the buttocks, points over the thighs, over the pectoralis minors. Then I'll also squeeze their elbows to see if they're sore there. Squeeze their knees. They're usually sore there as well. And I usually also press over their thighs. And in all those spots, you'll elicit soreness in fibromyalgia. Now, one thing to be cognizant of is you don't necessarily have to have every single one of those sore points. Occasionally, I'll have somebody that has, say, pectoral soreness across their shoulder girdle, but they're missing it in their elbows, for example, but then they have it in their knees. So part of the diagnostic criteria is that there's 18 of these key or critical to diagnosis points, and to say that somebody has sufficient of these points to warrant saying that they have fibromyalgia, they have to have 11 of these points, 11 out of the 18. So if I see a female comes into my office, actually this happened up to a couple days ago, approximately 40 years old, she comes in. Initially she's just complaining that she's tired all the time. And then as I'm looking over a chart, I realized that she'd already seen one of the other docs in my clinic. A full battery of blood tests was already run. There was nothing outstanding. Biochemically, she passed with flying colors. But then as I started to tease away the layers about this fatigue, she also started talking about trouble with sleeping, frequent headaches. In the chart note before mine, there was some mention that she typically feels anxious when she's in the office. Then she was also explaining, what was the other thing? Let's mention the headaches, the fatigue, the unrefreshing sleep, and then all this widespread soreness over her muscles. Even though she has a basically sedentary job and was doing no formal exercise. So immediately, my spider senses went off, or doctor senses, and I started wondering, well, is this fibromyalgia? So my next step then was to go around and do that survey of all the tender points, and lo and behold, she passed the test. So we have another member of our society in the fibromyalgia camp. So next up, how do we treat fibromyalgia? Now, as I alluded to earlier, it's often very frustrating trying to treat fibromyalgia because it's so refractory to most of the treatments that we have available today. Now, the first pinnacle of treatment is exercise. Even though exercise hurts when you have fibromyalgia, our studies have demonstrated that those people who keep active do better in the long run. In fact, we actually have evidence to suggest that people who do regular aerobic resistance type exercise, they do as well as somebody actually taking a medication or drug for it. And in this slide that I've put here, I'm showing here this lady here looks fairly fit and tough. and there's blood dribbling down from her mouth, that's to remember that the exercise is going to hurt, but it must be done. You do far better with fibromyalgia if you can push through the pain and do the routine exercises. Now, in terms of medications, one of the new ones on the market is Cymbalta or duloxetine. This is actually an old tricyclic. Well, actually, the drug is new, but it's based on the old family group of tricyclics, which perform a number of different receptor tweaks in the brain. So this has both an effect on the affect for mood, improves mood and anxiety and depression, but it's also licensed specifically for the treatment of pain originating from fibromyalgia. And so far, I would say I would have pretty good results with this one in a lot of cases. Another one that I would probably recommend, especially if you're one of my patients, would be pregabalin, or AKA Lyrica. Again, I have a subset of patients that do spectacularly well on this at high doses, but it doesn't work for everyone. And then there's some real old school treatments. This one here is something called Elavil or amitriptyline. Again, this is another tricyclic, but a much older one than the Cymbalta discussed earlier. And there's other members of this group like nortriptyline, diazepam, and there's a bunch of other imamins. Again, for these guys, I would say modest at best results from these older tricyclics. In some people, it's a godsend. In most, it leaves something to be desired. Now, at one point, I still had a subset of fibromyalgia sufferers, that weren't really deriving any benefit from any of these drug treatments. So I was pulling my hair out, and eventually I came across a newer form of treatment, which is a lidocaine infusion. Now, if you know what lidocaine is freezing, like what your dentist would use to jab into your tooth to numb the tooth. But in this case, this is going to sound crazy, but what we do is we take the lidocaine, put it in an intravenous drip, put it in your arm, and let it circulate through your bloodstream. The theory behind that is all those nerves that are turned on that should be shut off to allow your muscles to rest, when you passes through the bloodstream, it shuts off all those centers that need to be squelched or shut down, and turns off the fibromyalgia process. To have this done, all my patients that are getting this therapy are sent to an anesthetist. I suppose in future, as it becomes more mainstream, maybe you may be able to get it at specialty clinics, or maybe even at your family doctor, who knows. For now, though, it's a specialist intervention. A lot of it being because of the monitoring that has to be done, obviously because you're giving somebody a potent analgesic systemically through their bloodstream. But my patients that have tried this, the results have been pretty encouraging. Results typically last them for about 3 to 4 weeks, and then they need to repeat another dose again. But in a lot of cases, it can allow them to have a fulfilling, comfortable quality of life. And that's another thing about exercise too. My belief in why the exercise helps is because each time you contract a muscle and then let it go, contract a muscle, let it go, you're basically re-educating the muscles to learn to relax again. And that's the problem with fibromyalgia. The muscles aren't relaxing, they're staying tense all the time. And another thing that I've also noticed in a large quantity of these patients is a lot of them like to use a lot of stimulants, either smoking or caffeine, colas, energy drinks, chocolate, cheeses, stuff like that. So that's another thing I'll often recommend, is to try off those stimulants. Again, because all of those stimulants increase your muscle tone. So basically they're adding to the fibromyalgia problem. So that, ladies and gentlemen, is fibromyalgia in a nutshell. Thank you for watching. Don't forget to subscribe so I can keep you up to date as I upload new videos. And have a great rest of your day.
Thanks for watching. Get notified of new videos. Subscribe now.